have to go out, maintain social distance. And the importance of all these three things has been, again, demonstrated through the governor's press conference when he is even now talking about people who go to retail, grocery stores, something like that, and encouraging the grocery stores to establish policy and operations so that they can help enforce social distance. So it is very important that we follow these three principles to help minimize infection, which will help to reduce the surge that we know is coming and have that surge perhaps level off and decline quickly. Now, the governor, as I said, has instituted some policies and mandates, and we're following them very closely. Now I want to introduce a couple of doctors from the Cleveland Clinic and University Hospital because, as I mentioned, this is a very infectious disease, which means it is spreading, and what we know is really the small part of it. There's a part out there we don't know, except for the fact that we are projecting that there will be a surge, and that surge will happen in this month of April, if I'm understanding the infectious disease doctors. It will happen in April. And so what are we doing to prepare for that? And so I'd like to turn it over to our hospital partners so they can say what they are doing in conjunction with the state to prepare for what we know will be coming very shortly.
Thank you, Mayor. I'm Bob Wiley, and I'm the Chief of Medical Operations for the Cleveland Clinic, and I'd like to talk with you a little bit about our preparedness so far. So we're working with the State Board of Health, County Board of Health, the City Board of Health, all in conjunction with all of the hospitals in northern Ohio, as well as University and Metro, and we've been meeting, we've met several times and maintaining actually daily communications. For the Cleveland Clinic, we are increasing our number of beds from about 3,000 to 8,000. That will include about 5,000 regular nursing home beds and moving up from 500 intensive care beds up to 2,500 intensive care beds. We've also expanded the number of ventilators we have in order to try to meet this surge. There is one thing that we've seen in social distancing, and with our 11 hospitals in Northeast Ohio, we've been stable in the number of COVID patients for about the last 6 days. That's very important because we aren't seeing the dramatic increase. So with the mayor and the governor pursuing social distance and asking us all to keep social distance, closing the schools, what that means is we're starting to see a bend in the curve for the number of patients who are becoming infected. What that'll do is it'll lengthen out the disease process, but there will also be fewer people being infected, and there'll be fewer at the height of the infection. So fewer people infected at one time. That allows us and University and Metro to really provide all the care that the patients need within our current capabilities. So I'd like to ask University to come up and go ahead and comment.
Thank you very much. I'm Dr. Willie Bryan. I'm the Chief Medical and Chief Quality Officer at University Hospitals. And I just want to first start by thanking the mayor and his staff for really the fabulous job that they have been doing throughout this and their leadership. And I also want to commend the governor, lieutenant governor, and both senators in Ohio. They have been on the phone calls with us collectively over the entire time here, and they have shown great leadership for the state and for people in Ohio. And for those in Cleveland, I would say the people in Cleveland, it's a strong community. And you're seeing that everywhere we go. We get phone calls regularly about volunteers wanting to come and help any way they can, making cloth masks, working to help anybody who needs help. And that's really very important. We're also collaborating, as Dr. Wiley said, together. The clinic, Metro Health, SUMA, and the university hospitals are all working together. We have regular calls, regular briefing with the departments of health in each of the counties that we have hospitals in, and certainly here in Cuyahoga County. We're all in this together, and there's been just a tremendous outpouring of support around this. I do want to say that we also have been planning for the surge. We have taken this and broken our 6 categories, and we basically are varying those based on the number of cases that would come in at any given time around the system. We're planning for up to a 300% increase in our capacity at university hospitals, which would take us up to 6,000 total beds in our system. Again, 300% increase in our ICU beds as well. We've been working very hard to do tabletop exercises at each of the hospitals and as a system. I think that that's very important for all of us as we prepare for what the surge might look like, because we actually don't know which areas of the region are going to get hit first or hit hardest, so we really need to be able to be adaptable. We have the ability, and working with our EMS teams in place, to actually move patients or move equipment based on the need as well in this, if this and when this surge occurs. What I can tell you right now is we are currently cohorting our COVID-19 positive patients at the CMC Cleveland Medical Center campus into 1 ICU and 1 unit right now, but we have plans to expand that as needed if and when that need arises. We have ventilators in place. We've done our inventory of all of our ventilators, our personal protective equipment, and other equipment, especially our pharmaceutical drugs. We know what we have, we know what we may be short on, and we are prepared going forward. We have on order additional ventilators, and we're looking at leasing additional ventilators from around the country right now. Our concerns are ventilators, protective equipment, and test kits right now. And those are the things that we're really challenged by, and we're really working very hard on that. And so what I would say is that I think we are well prepared. We're working with Case Western Reserve University as well to create dormitories that they've offered to us for our staff. If we end up going into a shift mode where our staff can't leave and go home so that they could actually stay, find a place to sleep, and then come back to work at our campus. And we're also working with Case Western around the field house for a potential use as additional hospital beds in sort of an adaptive way. It's not a hospital now, but in an adaptive way, if we really need that, it could bring us another 250 beds into that area. So we're all working together. This is a collaborative team effort. I feel that we're in a good place right now, and we just have planned for the worst, and we're hoping and praying for the very best. And with the continued leadership of the city, I'm sure we all in Cleveland will come through this strong and stronger than before. Thank you.
Thank you. Now I'll briefly talk about some of the things that we're doing as a city. As you know, we declared a proclamation of civil emergency in March 11th. And as part of that, it set up executive policy group. Now this executive policy group meets on a daily basis, and they go over what is happening in terms of this emergency, and then they come up with recommendations on policies or changes that we need to have in order to meet the emergency. An example of that is us closing City Hall and doing essential employees, working with our human services, our HR department to develop a way in which we could accommodate essential, non-essential employees. We keeping all of the essential operations still going. Police, fire, EMS, waste collection is still operational. We have we've closed up all the rec centers and have worked with our food vendor for the hot meals that children have become used to at the rec center. And so we're doing a lot of things with the public safety. They are doing testing in terms of for symptoms. They have thermometers attempting to test all of the essential employees who are coming to work to see if they have symptoms. We are ordering additional thermometers so we can deploy them with our other divisions and departments to ensure that they can test their essential employees for symptoms also. As we move forward, not only have we closed the rec centers, we've closed playgrounds, and we are looking to, as we move forward, to recognize not only the health impact, but the financial impact this is having on not only city revenue, but the economic vitality of the city of Cleveland. And just recently, at the last council meeting, council president and city council passed legislation that we had introduced that really talks about how do we handle people who have loans with the city of Cleveland. The program authorized the director of the Community Economic Development to defer payment on most loans and to seek consent lenders on other loans. So we're working with businesses where we have loan packages with the financial support of those businesses to see if in fact they can, the private lenders can help defer as we defer for 6 months on the payment of loan. In addition, the city has established an emergency working capital fund in order to help maintain businesses in our community. And the way this works is up to $10,000 loan that will reimburse for operating costs incurred during the month of March. There's no fees associated, no interest or payments due until January 1st of 2021. And the maximum payment, I think, is $150 a month until the loan is paid off. So we're working not only with our partners on the health side, but we're working with our business community and to help them weather this virus and this pandemic also. Now, our initial funding of $1 million into the program that I just spoke of for businesses, we are doing that in order to fill this gap between the stimulus dollars and the time, this time now, and when the stimulus dollars become available. And so hopefully with that, we can help our small businesses in particular survive this pandemic, as well as the people of the city of Cleveland. So are there any questions you can ask now? And I know that there's been a process created where the media can ask questions, and we will be answering them all day. So if you don't answer, answer. We don't give it to you now, we'll give it to you later, and you can ask all day if you want. Yes, ma'am.
Hi. So we've heard various reports from some city workers, EMS, fire, that the city is not providing any notification that their coworkers may have been exposed to coronavirus, and they're concerned about their safety and their health. So what is the policy that the city is following when an employee in either of those departments or the police department?
Well, with its, you may have heard from public safety, but we have essential employees working all the time, whether in utilities, water, public power, public works, people who cut vacant lots, the waste collectors, fire, police, EMS, all those people we have. And so we do have a policy around it. So for public safety director or chief, the chiefs, do you want to speak to it? How do you want to do it? Chief Cavilla, Chief Williams, and Commissioner Carter.
Good morning. Chief Cavilla, Cleveland Division of Fire. So the way we're handling it is if our members do come down with the coronavirus, they'll be contacted from one of the three, University, Cleveland Clinic, Metro. They will then contact the division through the chain of command. That will then contact the health department. That's one way. Another way is the health department will get that information from one of our members within the division. They will contact me. I'll have my assistant chief, the infectious control officer, contact that individual to give them the directives in regards to the health department.
Is there any particular way that you're keeping them separate from people
During the shift?
Yeah, like some people, we've heard reports that some people are concerned that they've been exposed to these people who might have the coronavirus, so, and that proper measures have not been taken.
So per the CDC, we are considered critical infrastructure, police, fire, and EMS. So that means that if we do have a potential exposure, we continue working. We are the front lines of the city of Cleveland with police, fire, and EMS. So what that means is we self-monitor ourselves, just like the mayor said. We'll self-monitor before we get to work. We'll actually identify if we have any symptoms, and we'll continue on working. Once we feel that we're coming down with those symptoms in regards to the COVID-19 virus, then our members will actually strike off duty, contact their primary care or one of the 3 hospitals, University, Metro, or Cleveland Clinic, in regards to get a test priority so that we can confirm if that is truly the COVID-19 virus.
Thank you.
Commissioner?
Good morning. Commissioner Carlton from the Division of EMS. What I think you're referencing is if an employee indeed tests positive for COVID, how do we backtrack who they were in contact with? So when we get that notification, we work closely with the health department, and we actually look at who that person had significant contact with. For those employees who may have had contact, we look at it as a potential exposure to a known COVID positive person, and then they are advised. We make direct contact with those employees. What they are told to do is self-monitor twice a day, and all their employees are doing it once a day. They also are told to wear surgical masks for a 14-day period. But because we are critical infrastructure, they are expected to return to work and stay at work for those who have the potential exposure. So just because somebody may have passed somebody in the hallway, it's the risk, and we work with the health department on backtracking. EMS employees, it's been almost 2 weeks now where we are wearing surgical masks all the time while on duty. So when we are with somebody and they are in the front of the ambulance with the partners, they are practicing social distancing as best as they can. When they're driving to an emergency call, the driver actually uses the passenger to assist them with traffic. So they have surgical masks on all the time while they're on shift. And I hope that answers their question.
Yes.
Chief?
Good morning. I think Commissioner Carlton answered the question. We all have our procedures in place if an employee tests positive for COVID-19. That employee maintains contact with the health department. The health department gives us direction on those contacts and whether it's a high risk or a low risk. The Commissioner talking about if you work with a person, you only pass them in the hallway, that's a lower risk than if you're in the same vehicle with the person. The Division of Police about 3.5 weeks ago went to single-person cars for all of our operations, whether it's detectives, frontline officers, or others. So there's no personal, close-to-close personal contact in a vehicle with our officers. We practice social distancing within our operations in a district or in an office. So if there's a positive test, which we've had a couple, then those officers definitely don't have that direct contact, so that risk level is a little lower than had they been in the same car. Officers are notified, contact the health department, our medical unit, and then they're given advice or orders basically on what they need to do for the next 14 days.
And health can tell you, once they're notified of it, then the health department really takes over, and they're the ones who contact all of the people who they believe could have been exposed. So health,
Yes.
is that the process?
Yes.
And so they have a team of people who go out, they get the information from the division, and they then have a team of people who go out and interview and test, and then require self-quarantine if in fact is needed at that time. So there is no negligence on our part or lack of concern on our part for our employees, whether they're in public safety or public works or utilities. Okay.
Mayor, we have a couple questions coming
Yes.
in on social media from reporters. One is, where's the loan information you mentioned earlier on the council legislation?
We will get that to them. We will, in our briefing that we do every day, we'll put that into the briefing that we do every day, and we'll get it to them.
Okay, and I don't know if this is available yet. This is from Bob Higgs, Cleveland.com. University hospitals mentioned using the field house at Case Western for auxiliary space and beds. Is the city looking at locations that could become field hospitals or working with the state and National Guard? And he wants to know the locations.
We've been in contact with the governor's office, the infectious disease doctors at each of the hospital networks in Cleveland, with the National Guard and the Army Corps of Engineers. And as a result of that conversation, what the doctors presented today is where they are now. But they also know that there are other options that are available based on the need. But as of right now, if I'm understanding you correctly, Doctor, that you believe that what you're doing now is sufficient. Is that correct?
I have one more question for the city as soon as you're
Wait,
finished.
let's let the doctor finish.
So just in the aggregate, as we said, we've been working together. The surge plan is creating more than 10,000 new beds within the city of Cleveland. And that's not counting the beds which are surging in Akron. University is expanding in their facilities just as Metro is. And that seems to be more efficient than trying to set up something like the IX Center.
Concerns about hand washing stations and other hygiene concerns for people without shelter.
Yes, we've been working with Office of Homeless Service.
Yes.
Ruth Gillette is the director, I think her
Yes.
title is of that department. It's a county operation, but we've been working with them, and they have put in place with their partners and with us a strategy on hand washing, where we know that in order to eliminate the density at the homeless shelters, so that they can create a 6 feet area of distancing between social distancing, but there's still the need for additional capacity. I think there's they project about $600,000 has been put into that effort so far in order to address Metro Health, if I'm not mistaken, is committed to testing of the homeless population to help identify where there are symptoms or, in fact, there is an infection.
I have a question, Mayor.
Yes.
Regarding the homeless, it'd be probably helpful the city get some porta potties out there. They aren't able to go to the bathroom at that Starbucks that they used to pop their head into. Is the city doing anything?
No, again, the county handles homeless. We provide funding to the county along with other funding for the Office of Homeless Services. And they are looking at that as part of the ongoing discussion that we are involved with them. But that has not been determined as to whether or not that will happen. And if it does happen, were the resources to pay for it. There has been identification of the policy around hand sanitizers at homeless camps, the bedding of people at hotels in order to decrease the density at the homeless shelters and create social distancing, and also a way of doing mass testing to help identify those who have symptoms or actually have been infected. But that particular thing you mentioned, St. Patrick's Day parade and the film festival and the voluntary cancellation of what was happening at Playhouse Square. So anywhere that there's a potential mass gathering, we will not be issuing a permit for. Yes, ma'am.
So with 6 confirmed cases at the Cuyahoga County Jail,
Yes.
do the positive cases change the way that you're instructing police officers as they're arresting people?
Well, there's a policy, chief can answer that, as to where there are arrests and if we're arresting and what we're arresting for, and if you do arrest, what is the process for that? Yes, chief.
We just implemented a policy within the Division of Police. Anybody that goes into a police car is a mask is placed on that person. Anybody that's suspected or has symptoms or in a police car has to put on a mask.
And one more follow-up question. What would you say to the community, someone who has a loved one who is currently in jail now that there have been 6 confirmed COVID cases there?
Well, as you know, the city of Cleveland does not run a jail. It's the county government. I'd say that the county is probably doing their best to make sure that there are no more infections in the jail.
Okay, that's all we have time for today. Anybody else who has questions can submit them by email.
All right, thank you.
Thank you.
Thank you.
Thanks,